Hi everyone, this is Adrien, the exercise specialist at the Leduc Beaumont Devon Primary Care Network. I hope you all are doing well today. For today's video, I thought I would show you guys a few quick exercises and stretches that you can do to help loosen your low back. So I decided I would choose this video today as for a few weeks now. I've actually been dealing with a bit of a low back issue myself. I actually strained some of the lumbar kind of paraspinal muscles on my left side here, doing some heavy deadlifting, just a little bit, and so I've been doing, my rehab exercises while still continuing to train, keeping things appropriately, of course, for the last few weeks since. And I thought I would take you guys through what one of my basic low back kind of rehab-y mobility stretching kind of sessions looks like. So this section does not involve any strengthening movements. So there's no actual hypertrophic movements, so no exercises to build muscle or try and improve the strength in my back. This is just to kind of try and improve the mobility, the flexibility, the range of motion, and try and reduce the pain response in my back, as it gets very tight on the one side there. And when it gets tight there, it then goes into my hip, which then gets tight, which then goes into my knee, so on and so forth. Eventually everything is, lopsided, so we don't want that. So this video shouldn't be used to diagnose or treat anyone else's low back injuries or concerns that you might have. It's just one example, though a lot of these kind of exercises are often provided in programs for stretching or general rehab protocols for low back, but not necessarily. So for all of that, always go to your physician. So what it'll be is, I'll go through 6-ish exercises. I will go through each of them. I'll go 1, 2, 3, 4, 5, 6. And then usually I'll do that for 3 total rounds. I like to do that kind of stuff, change it up. I don't like doing 3 of the same exercises in a row, and so on and so forth, if I can avoid it. Just keep things moving. So I'll do each set of exercises, so the first set of each 6, and then I would do it for a second round and a third round, but for the video I'll only show the first round. But know that I will end up doing it for 3 total rounds, and I've been doing this almost every day. So between 5 and 6 days a week, I do these movements to help me recover, because your body does generally recover quite fast from general stretching and mobility work, obviously, right? So it's also important to know that though I do have this little bit of a thing going on in my kind of paraspinal area, that I have not stopped training. I've only adjusted and started training appropriately. So exercises that put a lot of pressure on the area, I avoid. But if I can do lighter weights on those exercises, then I still do them. You don't want to avoid those movements if you can. Okay. You don't want to completely stop exercising and set yourself too far back, or avoid exercising if you can on certain areas and become lopsided or off balance, or really regress a certain area. Though I may not be progressing in that area right now, because I'm not able to train that area overly hard, I am still working the area. So I'm more in a maintenance phase for that area with my rehab activities. So I hope that clears it up. This shouldn't be too long of a video here. As per usual, if you're new to physical activity, if you're returning to physical activity from a long layoff, or if you have a medical condition that might make doing physical activity difficult, please consult with your physician prior to beginning any new exercise program. Thank you. So, how I'm going to be structuring these today, like I said, I have 6 exercises that I'll be doing today. I will do all of them once. I do both sides, though I only have one affected side. I do both sides because you want to keep things relatively even. And just because my one side is tight doesn't mean that won't make my other side tight, because that side now has to overcompensate during certain movements, mainly around like stability and rotation. So I want to keep that side nice and loose too. So we always want to keep things uniform if we can. Train both sides of the body equally, unless there is a blatant substantial weakness or injury on one side, then we adjust accordingly. But in situations like this, when what I'm experiencing is minor, we want to try to train both things as equally as possible. So I'm gonna flip this mat up so we have a little more space, and we will begin. So I will go through all the exercises. And instead of doing a time, like a time that I'm holding each of them, what I will do is I'm gonna do it for 5 deep breaths each. So that might end up being, 10, 15 seconds, might be 8 seconds, who knows. It'll be 5 nice, deep, controlled breaths. And that's how I will do these. You'll see I'm not overly flexible, so some of these exercises might be helpful for some other people out there that aren't too flexible. So first one is going to be a cat-cow into, I believe, the child's pose, as it is called. So we get onto our sides here. We're going to come here. As you see, I have a neutral back, so my back is roughly parallel with the floor. This is already feeling pretty tight. So what we're doing is we're going to arch our back like a cat. So you see I'm rounding through my midsection here. Arch your back like a cat. Round your back. Round your back like a cat. Arch your back like you're saying moo, like you're a cow. So it's a cat, cow. So we do we go cat, you go cow, and we sit back into the child's pose. Stretch nice and far back, and let your arms stretch forward. Really lengthening out your entire back. And let's do this one for 5 total reps. Here, cat, cow. We'll do 2 cat cows each time. Cat, cow. Into the child's pose. Got a third one. Cat, cow, cat, cow. Stretch. Cat, cow, cat, cow. And stretch. Cat, cow, cat, cow, and then we'll stretch. Perfect. So that's the first exercise there. The second exercise, we're actually going to bring out the old handy dandy foam roller here. So this is my foam roller. This is just a standard foam roller. There's short versions like this. There's even shorter versions. There's also versions that are much longer. Usually they're made out of this high density foam stuff. Sometimes sometimes they're made out of some plastics. I have another foam roller on the other side of my gym there that has some rivets on it and some extension sticking out, so you can actually roll on them to get a more pressure. For this one, all we're gonna be doing, you can buy these anywhere. Winners sell these. Any gym store, Amazon, Walmart, anywhere sells these. I believe I bought mine at Canadian Tire for $15, so they're an awesome little tool. At times they can be overused, and their benefits are a little bit overhyped, in my personal opinion. A lot of the time, there's people out there that spend more time foam rolling than they do actually working out. We don't want that. So they can be a little overhyped, but they do have use. So what we are going to be doing. What I'll do is I'm going to place this under my low back here, okay? I get up on my feet, across my arms. Oh yeah. See, so this one will be, somewhat painful for me. So all I'm going to do, I'm going to roll up and down on my low back here. That's 1, and we'll do 5 total. And that's 2. And that's 3. That's 4, and that's 5. If you want to make it more intense, you go on your side a little bit, like directly on there. So for me, it's this side. So I could do 5, just light, really try to dig in there, right? So I'm trying to dig into the spot where I'm feeling, which is right in there. So you feel it, kind of work your way through it. Perfect. All right. So that's exercise 2 with the foam roller. Oftentimes, if I'm sitting around watching TV or something, talking to the fiance, I'll sit with the foam roller, roll out some of my tight muscles. Great tool that's very inexpensive. So next exercise is just going to be a basic lumbar rotation stretch. So for this one, What we're gonna be doing is we're gonna be laying flat, we're gonna be laying flat on our back, arms out to the side, and we're gonna take one of our legs, straighten it, swing it over the other leg to the other side. So I will show you guys here. Just stretch a little bit. All right, so we're gonna be right here. So as you see, I am flat out in front of you. On the side, we're gonna take our one leg, twist over, and try to get down to the other side as Coach Luna comes to join me. So you're probably gonna see both my shoulders remain on the ground. That is most important. If you're only able to go to here, that is totally fine. If you make it all the way over while keeping both shoulders on the ground, that is what we are looking for. You can always take this arm and pull the hip further if you need to. And come back. And then we do the other side. We want to keep both sides even. Perfect. So I often grab behind the knee here to help facilitate that stretch a little further. So that's one each. I'll do 5 total each side. So neutral, over, stretch. So 2, 2, 3, 3. And once again, I'm breathing through all these. 4, 4, 5, and 5. So you can hold those. You can hold those longer if you want to. Do more static stretching kind of movements. I'm generally doing them more to get some movement in my back. I'm trying to get things loose and moving. So that's why I'm going a little bit faster. The next one is a basic lumbar strip, which I'm sure most people have already seen. Legs down in front of you. You'll cross one leg over. So for me, it's my right leg over my left leg. And then take my left arm, so opposite arm, elbow on the knee. And I use my elbow to twist me. So push, and then we breathe a little 5 deep breaths. And if everything's feeling okay, as you breathe out, each breath you can try and push yourself a little further. So other leg now, so my left leg's gonna cross over my right leg. My right arm goes over my left leg. And I twist. Perfect. Started to loosen up a bit, which is a good thing. So, exercise number 5 is a simple side-to-side bend. You can do this one standing or sitting. So it's a little easier standing. You can generally get a little bit further in the motion, but that's okay. We'll just do it seated today. For this one, what you'll do, you'll take one hand, you can put it behind you, or in front of you, or hold your knee, whatever you want. I generally put it behind me. Take the other arm straight up, above you, or up here. We're gonna twist, and we're gonna bend over to the side, and twist. I'm sorry, not twist, but bend over to the side. So I'm getting a really good stretch through my lat muscle here, the muscle under my armpit there. And then, same thing, up, over, and twist. Like I said, 5 nice deep breaths. Whew. That's a good one. And so for the final exercise that I figure I would show you guys, it's just a little bit of a basic kind of rotation movement. So for this one, you're on your back again, arms are out to your side. You're gonna have your knees together and elevated, almost in that dead bug position I've shown before. And all we're gonna do there is we're gonna start rocking our legs side to side to try and loosen them up. So to show you guys, I'm here. I'm flat on my back, legs come up. What you're gonna do is you're gonna bring your legs to one side,
as far down as you can. If you can touch, fantastic. And up and other side. And we're just going to go back and forth. Over 5 each side. That's 3. And 3. 4. And 4. 5. And 5.
There, so that's all 6 exercises, so that's 1 round. I would generally do that personally for 3 total rounds. But we don't need this to be an hour-long video watching me roll around on the ground, do we? Just to show you guys for a little bit, for example, so my non-affected side, I'm currently able to, go over to about there. So, decent angle. My affected side, I'm able to go to about here. So here, as opposed to here. So on my good side, I'm like this, and if it was to mimic that side, I'd probably be like this. So I'm still missing a decent amount of range of motion, but these exercises have been very helpful so far. I went from no range of motion a couple weeks ago to this. So it's very good. It's something that you need to continue, or that I will be continuing. Any kind of rehab or, small muscle strengthening or really, basic injury kind of rehab recovery stuff, it can be slow and it can be arduous, but the process and the progress is noticed more over the medium term, to where day to day you may not notice much improvement. You may feel better, you may feel worse day to day, but if I look back a few weeks, I've made significant improvements, and another couple weeks and I'll be good to go again, and that's what's important. So I hope you guys found it helpful. That's by no means an exhaustive list of low back kind of mobility movement exercises. That's really simple. There's hundreds of them. That's just an example of the 6 that I'm currently using. I have a few others that I will throw in there on occasion that maybe I'll show on a different video. But yeah, feel free to like the video and subscribe to the YouTube channel. If you have any questions, feel free to post them down below. My name is Adrien. I'm the exercise specialist at the Leduc Beaumont Devon Primary Care Network. Thank you so much and have a great day.